Hey guys, it's Amanda Rosenbaum here, doing the second part of the question and answer series from our parent questions. I am the owner and chief clinical officer at Anchor EDA, and this part two is from the original question dump that we had about like a week ago now or so. We've gotten more questions since part one was posted. Hopefully, you guys continue to send questions. I'd love to keep doing this. Hopefully that means it's beneficial for everybody, which I love. So I'm really excited. We'll get to part two. And here we go. We'll jump right in. All right. Why are parents important to ABA? I don't help in any of my kids' other therapies. Okay. So to recap from the last video, I've read these questions, but I only read them once and kind of scanned through which ones I wanted to put in the original two videos. So I haven't actually like sat down to answer them, and then I paired them with a photo to remind myself of what the question was and kind of what I was thinking when I read it for the first time. So if I hesitate, it's because this is the first time I'm really getting an answer out there. So why are parents important to ABA? And I don't help in any of my kids' other therapies. That's true. Maybe your other therapies would like you to be more of an active participant. I don't know. I don't know what they're in, but depending on the provider, pertaining to what they're doing, they may want you to practice at home. I'm not sure. I won't speak for them. What makes ABA unique that we want parents to be important and be a part of it is that we want your participation, because eventually we want all the skills we're working with your kids on to generalize to you. So it's great and fun and dandy when we can have them do things or help them do things or get them to do different vocalizations, different words, different academic work, different functional living skills, whatever. But if you can't do it on a Saturday when you're out to eat, that's rough. That's not helpful. That's difficult for you guys. We can work on sleep hygiene and doing routines, but if you guys don't learn how to do it too, then 2 a.m. is not going to be fun for anybody. So I don't mean to joke by any means, but it's mostly because we want to generalize these skills to you guys, and we want you guys to be able to do them. In essence, we're working ourselves out of a job. I know that sounds crazy and counterproductive, but nobody wants therapy to last forever. We want you guys to know the tips and the tricks and the things to do so that you guys can help with the behaviors and work with your kids on your own. So yeah, that's why it's important. How am I supposed to recreate what you do when you're not here? Follow through. I'm glad I put that photo there for myself. Follow through. We will give you plans. You should have a behavior intervention plan. You should know kind of what the treatment plan is. You should see how things look. You should be there while we're running some sessions. Hopefully your provider's doing some parent training sessions or parent coaching sessions. So at that point, you should just be able to follow through on what we've already coached you through, what we've already taught you about. So that should be something that you guys are able to do. And if you're not, talk to your provider. Tell them that you need a little bit more support. Tell them that you need a little bit more help. So then that way we can help you follow through. But if we're not there and you're trying to recreate a behavior management plan, follow through with what we've taught you, what we've modeled, what we've coached, and hopefully then you guys can be able to recreate it. And if you need more parent coaching, like always, speak to your provider, talk to your BCBA, talk to the services that you're currently working with, and tell them that you need a little bit more support. How are you trying to be a diverse company? I liked this question. And that's a hard question. That was a very deep question, but I liked it. How are you trying to be a diverse company? So I guess diversity can be interpreted in a lot of different ways. I think the main way I'm trying to be a diverse company overall right now is I'm trying to make applied behavioral analysis accessible to all, meaning those without insurance, those with insurance, but it's not great insurance, those with great insurance, kids who have been diagnosed with autism, kids who have not been diagnosed with autism, people who are waiting to be diagnosed with something. I'm trying to kind of branch out and make this great therapy that I believe in so much and I think is so beneficial to so many people. I'm trying to make it accessible for everybody. I'm trying to target different communities. If you haven't seen the video where I talk with Brittany about diversity, race and diversity in ABA, check it out. It should be everywhere on our page, exactly where you're finding these. It's a great video. It's a great watch. But we kind of talk about accessing some communities who may not have this resource, in their tool belt, if you will, or they may not know about this resource, or they may not know anything about this world or about autism at all. So definitely trying to be diverse in the sense of who can access ABA, who can benefit from ABA, and who may need trainings on what behavior is, what applied behavioral analysis is, what autism is, all of these different things. Hopefully Anchor is going to do some really exciting things in the future. Hopefully I can announce those soon and share in that pride with everybody that, we're trying to branch out and do some trainings for some certain people to, become a part of some other communities that may need us. So I think that's really what's making us a diverse company, is that we're trying to get this accessible for everybody who needs us. I'm struggling to be a mom to multiple kids, let alone one with autism. Any advice? I liked this question a lot. Moms and dads both have it hard, guys. Parenting is no joke. It is a hard, we call it me and my husband call it like parenthood. So we call it the hard hood to be a part of. It's not easy, man. It's not easy. And when you have, one kiddo, parents, a rough job. You have multiple kiddos. Goodness gracious. I know that for myself. It's a lot. And then you have, a child with disabilities of any sort is not easy either. So any advice, if you're not receiving services right now to make your life a little bit easier, please reach out and see what services are available to you. Hopefully that is something that's already been done. You're already working with people and that's helping you out. The other thing would be have a break. Take a break, mom. Take a day off. Take a spa day. Just take a day to lock yourself in your bedroom and binge Netflix. Find a trusted person. Find a trusted adult. Find somebody who knows your children, who knows your child with autism, who would know how things go. I know that it's hard leaving kids, period, never mind a child with autism or another developmental disability. That's stressful, and you want to make sure your child's being taken care of. So, hopefully you have someone who can help there. If not, reach out. You can reach out to us. We have some great resources and referrals to help you guys find some respite care or some date night care or just some me time care, things like that. We can help with that. So reach out to me, please. At the end, I'll put my email address, as I always do, and hopefully I can help you out a little bit more specific to you. But my biggest advice would be try to have the courage to take a personal day and just have a break. You deserve it. Reach out to this community, find a mom's group or a dad's group or an autism parents group and join it, and have other people that you can talk to. Because it's one thing when you talk to your friends and maybe they have all neurotypical children and you tell them what you went through and they give you some sort of advice you don't want to hear. And that's the worst type of advice ever. So you might want to talk to somebody else who, you say, yeah, little Bobby said his first syllable sound, and that mom's gonna freak out with you because she knows what a big deal that is. So that would be another piece of my advice. Find your community, find your people, find your parenthood group, if you will. How do I tell my ABA provider I want my daughter to do more functional things, not just matching and stuff? I liked this one. So that's a good question. And I would say the way you just typed it out would be perfect to shoot right back at your provider. Whoever your provider is, there's a reason. So first ask why they're doing certain things. If they're doing like identical to identical matching or non-identical matching or something like that, it's serving a purpose, it's serving a function, and it's helping in some way. So ask about the treatment plan, ask about why this skill is being presented, ask about why she's working on this, but then also make sure that you are targeting functional living things. And maybe it's embedded somewhere in the program where your ABA provider is actually doing prerequisite skills and they're building up to bigger things. So if you want your child to be potty trained, let's say, and your ABA provider isn't just running off and putting your kid on the potty nonstop, maybe they're working on pulling pants down and pulling pants up. That would be a prerequisite skill. That'd be kind of one of our early signs that a kiddo's ready to potty train. So maybe they're working on that step. But overall, if if you're like, yeah, Amanda, that's already done. All that's done. I already asked, I already talked to them. I know everything. They're just not doing functional living skills things or functional sorts of programs. Talk to them. Tell them what you would like. Tell them that you'd like to start some chores with your child, depending on how old they are. Tell them you want some more communication that's functional. Things like that. And, just start that conversation. As easy as typing this out. Just start that conversation with them. And hopefully that helps. How are you trying to be a part of the community? Oh, and I did put this picture up because I couldn't get over how pretty this picture is of downtown Cincinnati. So I have lived in a couple different states. I know I mentioned it in a lot of different videos. So I always like looking at each state that I'm currently living in, like the big city near us, what it looks like at night. So when I found this picture, I was really excited. Beautiful city. I've never got to be at that Ferris wheel, but I'd love to go once COVID is not an issue to be afraid of. But how are we trying to be a part of the community? I am trying to be a part of the community because I talk a lot, if you can't tell. So I try to just talk to everybody. I reach out to the different societies in the area, the Autism Society of Cincinnati, RAC, different communities, different providers, different adjacent fields, fields that may not necessarily have 100% to do with ABA or even autism, but fields that also adjacently work with kids. I'm trying to be a part of that. We do some charity as a company, which I like and I'm really proud of. We're part of the Walk for Autism this year, even though it's going to look a little bit different. So this year we're just joining as a business team, which I'm excited about. We're trying to join some other community events. Hopefully, fingers crossed, everyone stays healthy and they happen, where we're giving back to the community or we're speaking to the community as a whole. We're working right now to see what we can do for trainings to help training different members of the community, and get them some of the educational stuff that they need to know a little bit more. Yeah, so that's what we're doing. But if you have any recommendations or any ideas of how we could be a bigger, better part of the community, we'd love to know, and we'd love to take that suggestion. My son has such a limited diet. Is this something ABA could help with? Seriously, he eats almost nothing. Yes, ABA can help with the behavioral components of food refusal. So I'm going to make that very clear in this video. Food issues overall need to be checked out by a medical doctor. Hopefully as specific as a GI professional. A gastroenterologist would be great. One who works with pediatrics and one who works with autism would be even better. But a medical professional nonetheless should look at your child and talk to you about what's going on with your child. You should absolutely look at that. Sometimes it's not actually the food. Sometimes it has to do with swallowing or something orally with the mouth. That's going to be more of a speech path. Speech pathology, they're going to do more with swallowing than I can do with swallowing. They're going to do more with chewing and motor functions than I can do. If it's something with fine motor grip or handling spoons and forks and things of that nature, that's going to be a little bit more of an occupational therapy issue, and they may be the provider to go to. Now, all of these providers I named, first and foremost, the medical professional, make sure your child is medically okay and make sure that they are in tip-top shape. And then speech and OT. I love working with speech and OT. I love hearing from OTs being like, hey, Amanda, we're working on this type of grip or this type of fine motor. If you can kind of integrate that into your program, great. Because now they're working at it when they're at OT, but now I'm also helping them work on it because I got the direction right from the OT. So now, we're integrating it into our program. And now instead of it just, getting worked on once a week and every now and then when the family gets to it, it's being worked on every time ABA is there and OT is there and when the parents are there. So we're kind of hitting it from all ends. But to go back to how ABA could help with eating, we help with the behavioral components of eating. So sometimes food refusal, food selectivity, the act of rumination, which is like throwing food back up. Sometimes those are coming from more of a behavioral place. Sometimes they're coming from a little bit of behavior and a little bit of sensory, which would fall into that OT. Sometimes they're coming from all three and you need a speech and you need an OT and then maybe you need a behavioral person. Because remember, anything that becomes aversive starts to register in the brain as a behavioral issue. So if, let's say, you're struggling with swallowing, my son struggles with swallowing from what he's been through in his past, and some of the issues he's had. So he has a hard time swallowing, and that's definitely more of, a speech thing. That's from here. But let's say your child has such a hard time swallowing, they're throwing things back up. Now, not only is this here, and this needs medical attention and a speech path to help you swallow, and probably a swallow study, and all of these different things that are not ABA. But now it's so not fun and horrible to throw up all the time. Your brain is telling you, like, I don't even want to eat because that's so aversive. That's so, like, not happening. I don't want to do that. Now it's going to turn into a behavioral pattern as well. That's where ABA can come in. And of course, we help with cases that are not that severe either. So we do help with a lot of cases, and I did do my master's thesis on this, and I've worked within a couple different companies just working on food refusal and food selectivity when it is just a behavioral component, or when it is a behavioral issue, meaning they've been checked out by the doctor, they're cleared. They got checked by a GI, they're cleared. They checked by an OT and a speech, they're cleared there. That all looks good. And now we're looking at it's behavioral. It's a learned pattern of behavior that we have to unlearn. So I have done that. I have worked with that extensively because of what I did in my master's program, and then in companies past. I enjoy doing it. We do work with some nutritionists. We kind of consult with them to make sure that we're doing balanced diet. I am no way am a licensed nutritionist. I'm saying that on video. I am not, but I consult those who are to ensure I'm helping with that. And then we just use a lot of principles of behavior. And that's where we live. That's where we stay. We stay within our ethical bounds of practicing within the realm of the principles of behavior and trying to help with food. So hopefully that helped. I know there's a couple of really great people that you can follow on like Instagram who are behaviorists, but also are nutritionists. And they've got some really interesting Instagrams that you can follow. And I follow a couple of them, and I forget their names off the top of my head, but if I can remember them, I'll post them below, or if you email me, I'll send them directly to you. But that was a good question. So short answer is yes. Long answer is talk to a doctor first and foremost before you do anything. Do you work with other field areas like speech and PT? Yeah, so like I was just saying before, I have worked very closely with multiple different speech pathologists across different states. Physical therapists, a little bit less, but still work with them and have worked with them, especially with my own son as well. OT, much more heavily than PT, I would say. I would say the two main fields that we usually work with that kind of are all at the table working together on programs and areas of concern are speech, OT, and PT. But we do work with a lot of different adjacent fields and adjacent disciplines, and I like it. I think the more people who can help, the better. I don't think that we should all be opposing forces and discrediting each other's ideas. I think we should all be kind of helping things run smoothly and targeting things from multiple different areas, because at the end of the day, we're all working to help the same family, and we're all working to help the same child. So it's better to build up your team than break it down. So for sure. What do I do if I think my son has autism? He's 15 months. Developmental pediatrician. That is the first thing I will say to anyone. BCBAs do not diagnose. So if you speak to anyone who is a BCBA, know that they cannot diagnose your child. You can ask them all day until you're blue in the face if they think your child has autism. What I think means nothing. You should speak to a developmental pediatrician. There are other disciplines who can diagnose autism. I have a really big post on my frequently asked questions on our website, www.anchoraba.live. It's right there. And we kind of go through the different professionals who can diagnose. So you can do different psychology professionals. But my big one would say, go to a developmental pediatrician. I know Cincinnati Children's Hospital is fantastic. They're just fantastic. So try there. If you really need help and you really need direction, please email me personally, and I can try and work and get you some referrals more specifically of professionals who can do an evaluation and the diagnostic criteria needed. But if you think your son has autism or another developmental delay, please reach out. The sooner you reach out, the better. Early intervention is key. Also, EI, early intervention themselves in this state, is fantastic. We worked with them personally. I've worked with them as a part of the adjacent professionals as well. So they're another huge resource that you guys can and should reach out to if you have not already. but please go to a doctor, go to your pediatrician, go to a developmental pediatrician, talk to a doctor about your concerns, because your concerns are most likely valid, and you should talk to somebody. Best of luck too. And that's it. Those are all of our questions for part 2. Thank you guys for sending all of your questions in. Thanks for being like super part of this. It's been great. Hopefully you guys send me more questions. If you want to visit us at our website, it is right there, www.anchoraba.live. Look out for more parent coaching sessions. Contact me about registering for some parent coaching sessions that are coming up. Question and answer sessions, we've done 2 now, so I'm glad that they're going so well. Hopefully they can continue. You can subscribe for free to our newsletter, or you can contact me directly with questions, concerns, or possibly to register your child for services at anchoraballc@gmail.com. Thanks guys. Thanks for being a part of this. Thanks everyone who listened and has been sending in questions. I love them. Keep them coming. Have a great night, everyone.